Welcome back to San Diego People. The Clearity Foundation is a local nonprofit that works with women who have been diagnosed with ovarian cancer. Clearity offers various services to help inform women about which treatment might work best for their specific cancer or tumor. Joining us now to talk more about the free programs that are offered for women who've been diagnosed is John Crawford, former board chair and caregiver for the Clearity Foundation. John, thanks for joining us.
Thanks for having me.
This hits really home for you.
It does.
Talk to us about how you became a co-founder.
Well,
what happened?
I was working for Laura Shawver, who's our founder, and she had just come out of chemo she was getting her hair back and so forth for ovarian cancer. And she was really, as a drug developer, she's been in the biotech industry and the pharmaceutical industry all of her life. And as a drug developer, she was just astounded by what wasn't being done for ovarian cancer patients. There wasn't the resources there to understand her cancer and what to do if it might recur. Mm-hmm. So she wanted to start a foundation. It was the only way we could see to do it, was to do a nonprofit foundation to help provide information and services to ovarian cancer patients to help them through their journey. So I signed on for that. I'd been in the biotech industry. We got a bunch of other biotech executives and participants involved, and we formed the foundation. The part of it that was very serendipitous or quite a surprise to us was that 2 years later my wife was diagnosed with ovarian cancer. So it became a very personal mission at that point.
And it was at that point that you really had to consider treatment options, right?
Yes, and Clearity was there to help us do that. We have the first-line therapy is a standard chemotherapy that's done with most all patients. But after that, and it very often relapses or recurs, and after that, it's kind of an open schedule there as to what you might do to treat the cancer. But if you understand your individual cancer, we can help guide those treatment options. There may be clinical trials that you need to go into or that you should consider. And so we help give that information to the patient as well, help them guide through that process.
And we're specifically talking about ovarian cancer because you said the numbers were not encouraging.
That's right, yeah. The survival rates are 25%, something like that, beyond the 5-year time frame. Mm-hmm. And recurrence, of course, is very high with this cancer. Very often the patient doesn't even go into remission on the standard treatment.
So what you do at the Clearity Foundation is a doctor gives the diagnosis to the patient. You're right there, the three of you kind of working in concert to make sure they're the best treatments and resources that are available. Is that right? Well,
when the patient is diagnosed, they often find us on the web and contact us, and then we start to counsel them. We also offer a Steps Through Ovarian Cancer program, which is counseling to help them with the emotional aspects of it and the family and so forth. And it may seem funny that a fellow is here talking about a woman's cancer, but it's a condition for the whole family to deal with.
Are these symptoms that we're seeing here, bloating, pain, pressure, are these symptoms of ovarian cancer?
But, you know, despite the fact that my wife had been to many, many sessions of presentations and so forth on ovarian cancer and knew all about this, she was diagnosed at 3C. Late in ovarian cancer is very, very common. That's the case. It's a very subtle disease. It's hard to detect, and even though we were as informed as anybody could be, it got right past us.
And what was the best treatment for your wife?
Well, she went through the standard chemotherapy, first-line treatment, and we knew from a profile that we had done on her that it was likely to work because of the character of her tumor, and indeed it did. She's been in remission for 8 years now.
Oh, that's good to know. Yeah. Oh, yes. Okay, you were talking about something called a blueprint where you can look at I think you said a tumor?
That's right.
And talk to us about how your blueprint works.
Well, we characterize a tumor on a molecular and a genomic basis and use that information to help guide the physician and the patient as to what the therapy should be if the patient recurs. So there are clinical trials that can be considered. There are cancer drugs for other cancers that can be considered depending on the nature of that patient's cancer. Mm. And historically, doctors had a tendency to say, well, my second-line therapy is usually this, that's the standard of care, it doesn't cause much nausea, things like that. And that was not adequate. You want to get a therapy that is directed at that patient's individual tumor and will help it has the best chance of addressing their particular cancer.
And is this something that an HPV vaccination could have prevented?
No, it's not related to that. No.
And how about immunotherapy?
Immunotherapy, I think, will come into this play. I mean, it's going to be useful for a lot of cancers. Right now, the standard of care is chemotherapy, and I think that'll be the case for for a long time. It'll still be chemotherapy that'll be the major treatment for it.
When a woman is diagnosed, in your experience, what are the biggest questions she has right when she gets a diagnosis? You've been through this with your wife.
Yeah, I have. It's well, we were somewhat informed because we already knew about Clearity, so it was kind of a double scare for us because we knew how serious it was. They slowly become aware of how serious it is. They need to quickly get into surgery. It's a difficult surgery. It's often 6 or 7 hours, where they do what they call a debulking and often remove parts of the intestine and cancerous lesions in the abdominal cavity. And then they start chemo right away. So it's a pretty rough course to go. You've got the emotional aspect of, what's going to happen to me. You may have a job, what you should do on that. Now, for instance, my wife kept her job, which seemed crazy. I actually wound down my consulting practice and helped her through it, and she kept her job because you want to have a life to go back to. And this is one of the things that we try to do in educating women, is to think ahead and not just feel life is over in this process. Cancer outcomes are much better when people have a positive outlook and have a lot of hope. And Clearity is there to offer a lot of hope.
And you mentioned trials, clinical trials. How common are those? Because we hear that, well, it hasn't been approved by the FDA, but there are clinical trials going on. Do you involve yourself with companies like this and try to stay at the tip of the spear, so to speak?
We do. We know all of the trials that are taking place that might impact ovarian cancer patients, and we know what they are addressing, which aspects of cancer they are addressing, and for the individual patient, we can identify which might be the best for that patient.
I see.
So we provide additional information. It's not just going into a clinical trial, but one that specifically may address the molecular profile that their cancer tumor has.
Okay, and if there's somebody in our viewing audience who wants to reach out to the Clearity Foundation, who might have recently received a diagnosis, for example, how can they get in touch with you?
ClearityFoundation.org. It's CLEARITY foundation.org.
And they've got information there and a way to get to contact you.
We have all the information on there, yes. Indeed.
All right. All right. Thank you for your time,
Great.
sir.
Thank
Appreciate
you.
it. All right. That's it for this morning's edition of San Diego People. Join us tonight for the KUSI News at 6, 10, and 11.